Hi, my name is Sequoia. I'm a nurse practitioner student with Penn West University. I'm going to be doing your physical exam today. I'm going to wash my hands. And the first thing I'm going to do is check your blood pressure. The patient's been sitting for about 10 minutes now, so I would check her blood pressure on bilateral upper arms with a regular adult cuff. For the video purposes, we'll say her blood pressure was 120/80 in both her arms. The next thing I'm going to do is inspect her skin. So using the back of my hands, I can feel that it's warm, it's dry, nice and pink, appropriate for ethnicity. There's no rashes or lesions noted. The next thing I'm going to do is inspect her pulses. I'm going to palpate her pulses with the pads of my 2 fingers, starting at her carotid, then the radial, femoral, popliteal behind the knee, dorsalis pedis on top of the foot, and posterior tibial. Okay, all of her pulses are 2+ bilaterally. They are symmetrical, a rate of about 74 beats per minute with a normal rhythm. There's no bounding or threadiness noted. I'm going to inspect her eyes next. Without her glasses, I'm just going to look at her external eyes. Upper lids are normal. There's no drooping noted, no styes or inflammation or swelling. If I pull down, I can see her conjunctiva are pink, they're clear. Sclera is nice white and clear. Eyes are symmetric with one another and they line up with the pinna of each ear. I'll use my ophthalmoscope next to inspect the inner eye, and you do this about 2 to 3 inches away, your right eye with her right eye, left eye with left eye. I can't see it on my left eye, so I will use my right for both. Okay, so the media is clear, her fundus is visible. I'm able to visualize the retinal nerves. They are normal, there's no narrowing noted. The optic disc and optic cup are both visible. Optic disc has good margins, it's a yellowish orange color. The optic cup is noted inside the optic disc. It's about less than 1/3 the size of the optic disc. The macula is also noted in the eyes. It is dyspigmented color with the fovea noted on the inside. The next thing I'm going to do is dim the lights. And I'm going to inspect her red reflex. And you should do this about 3 feet away. Okay. Red reflex is present in both eyes, no signs of cataracts. I'm going to use my pen light next and assess for pupillary response. So look at a spot on the back of the wall, and I'm just going to shine this light in each eye. Okay. Pupils constricted appropriately. I'll turn the lights back on. And she's going to use only her eyes and keep her head still to follow this pen light. Okay. No nystagmus is noted. Her pupils are constricting and converging, and dilating and diverging. Good. Okay. So cranial nerves 3, 4, and 6, the oculomotor, trochlear, and abducens are intact. We tested cranial nerve number 2, the optic nerve, using the Snellen chart, and her visual acuity was 20/30 bilaterally with corrective lenses. I will inspect her nose next. Using my otoscope, I'm just going to look at both of her nares. Okay. Her nares are patent. There's no obstruction, no rhinitis or epistaxis, and nasal turbinates are visible. There's no swelling or inflammation. She declines any changes in her smell, and cranial nerve number 1, the olfactory nerve, is intact. Next, I'll look at her outer ears and just compare the two. And both ears are equal, they're symmetric, there's no lesions, masses, or any abnormal growths on either. I'm going to inspect the ear canal and tympanic membrane using my otoscope. And I'm going to pull her pinna up and back on both ears since she is an adult. Okay, and we'll look in the right ear as well. Okay, both ear canals are clear. There's no obstruction, inflammation, redness, and her tympanic membrane is visible with a cone of light. It's a pearly gray color. There's no fluid behind either ear or behind either tympanic membrane or bulging or redness noted. So both are normal. While we're inspecting her ears, we're going to test cranial nerve number 8, auditory. So I'm going to plug one of her ears and whisper in her ear, and she's going to loudly tell me what I said. Hello. Bye. Good. Cranial nerve 8 is intact. Next, we will assess her mouth, and I'm just going to use my pen light to look inside her mouth. Say ah. Okay. Uvula is midline, it rises and falls appropriately. And her oral mucosa is pink, it's moist. Stick out your tongue. And lift your tongue up. And can you move it to either side? Good. And stick out your tongue again. And again, move it side to side. Okay. So some poor dentition noted, but her tongue is midline, it's not deviated to either side. Again, her uvula rises and falls. It's midline, and I would test her gag reflex using a tongue blade, and that would test cranial nerves 9, 10, and 12. And those are the cranial nerves glossopharyngeal, vagus, and hypoglossal. So next we're going to move on to carotid, and I'm just going to listen to her carotid arteries and make sure there's no bruits. And I'm going to use the bell of my stethoscope. Okay. No bruits are heard with auscultation. I'm going to inspect her neck, and I'm just going to look at it first. I don't see any goiters or nodules or abnormal growths. When I palpate, I don't feel any nodules, and I should feel her thyroid right in here. It's butterfly shaped, it should be smooth and symmetric. If she swallows, it should rise and fall. Good. And then palpating from behind. Okay, swallow again. Good, okay. Thyroid is normal. We're gonna inspect her lymph nodes next. So they should be soft, mobile, and non-tender. I'm gonna start with her preauricular in front of her ears, postauricular behind the ears, occipital, tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, supraclavicular, above the clavicle, infraclavicular, under the clavicle, and in this area you should not feel any lymph nodes. If you do, there is probably an infection somewhere. All of the lymph nodes feel normal. She declined any tenderness. So the next thing we're going to do is listen to her lungs. Okay. So take a deep breath in through your mouth. Good. Left upper lobe, right upper lobe. Okay. Take a deep breath again in through your mouth. Left upper lobe, right upper lobe, right middle lobe, left lower lobe, good, and right lower lobe. Good, okay. So no adventitious lung sounds, there's no stridor, wheezes, rhonchi, or crackles noted. The lungs are clear bilaterally and throughout all lung fields. Next we're gonna do the breast exam. For video purposes, we're not actually gonna do it, but I'll describe the process. So the patient would be sitting in 3 different seated positions. The first one's relaxed with her hands on her thighs, and then hands at the hips, and then leaning forward like this, which accentuates any dimpling. So we would start at the nipple and move our way outward, and you would feel for any masses, nodules, check for any dimpling, discoloration, and again, assess for nipple discharge. You would also inspect and palpate the axilla region, which is where the lymph nodes would be. So she would then do this again in a lying down position. So we're gonna have the patient lie down. And I'm gonna listen to, or I will explain the breast exam while she's lying down. So if you inspect the right breast, her right arm should be up, and again, you would just start at the nipple and move outward in a circular pattern and go into the axilla region, and then you would do the same thing on the right, or the left, I apologize. And can you sit back up, please? So we're gonna test cranial nerve number 5 next, which is the trigeminal nerve. I'm gonna have her close her eyes for me, and you just say yes when you feel me touch you.
Yes. 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 Yes.
Okay, you can open your eyes. Was the sensation the same on both sides?
Yes.
Okay. Can you tighten your mouth? Squeeze your mouth together? Okay. And I'm gonna palpate her masseter muscles and temporal muscles, and they're intact. So cranial nerve 5, the trigeminal nerve, is intact. Next we'll assess the cranial nerve 7, facial nerve. She's gonna squeeze her eyes shut. Squeeze your eyes shut. Good. Puff out your cheeks. Don't let me push your air out. Good. And raise your eyebrows. Raise your eyebrows and smile. Okay. Cranial nerve 7 is intact. Next, we will just inspect cranial nerve 11, which is the accessory. So she's going to turn her head against my hand. Good. Again. Good. Shrug your shoulders. Okay, and one more time. Good. Okay. So all her cranial nerves are intact. The next thing we'll do is listen to her heart sounds. So we're going to start with the aortic valve, and that is the right sternal border, second intercostal space. Pulmonic is the left sternal border, second intercostal space. Erb's point, left sternal border, third intercostal space. Tricuspid is left sternal border, fourth intercostal space. And the mitral is the midclavicular, fifth intercostal space. And sometimes in women you might have to lift their breast in order to be able to hear. And then we would do the same thing with her lying down. When they lay down, you can hear murmurs a little better because of the increased pressure. I did not hear any gallops, murmurs, rubs, S3 or S4s, and it was a nice sinus rhythm with no bruits heard. So she's gonna lie back down. Okay, and while she's lying down, I'm gonna listen to all of the lung fields, or all the heart sounds again. So aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. And again, no S2, S3 sounds, no murmurs, gallops, or rubs, no bruits heard. S1 and S2 sounds are normal, rate of about 74 beats per minute. I'm going to palpate her point of maximal impulse, which should be midclavicular, fifth intercostal space. It should be a non-sustained tapping, and we should not feel any thrills or heaves, and it should be about 2 to 3 centimeters in diameter. You would do this on a patient with unclothed, but for the video we're going to do it clothed. So just using the pads of your fingers. Okay, so there are no thrills or heaves noted. Next, what we're gonna do is inspect her abdomen with her knees bent up like this. I'm just gonna look. She's just gonna breathe normally. And I can see that her abdomen is a little rounded, but it's not distended. There's no ascites noted. Her abdomen rises and falls symmetrically with each breath, and there's no side that is larger than the other. So we're gonna we're gonna auscultate next. And I'm gonna auscultate all 4 quadrants, the aorta, the femoral, and the renal arteries. So right upper lobe, or right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. The aorta is just above the umbilicus. And the renal arteries and then the femoral. Okay, good. There's no bruits heard, and all 4 quadrants have normal bowel sounds. They're not hyper or hypoactive. I'm going to percuss her abdomen next, and there should be a tympanic sound over all 4 quadrants and a dull sound over the liver. It should be midclavicular line, right at the bottom of the rib cage. And you can hear the dullness of where I'm percussing and where it ends. Okay. So I'm going to palpate for any hernias or inguinal lymph nodes that are possibly swollen or tender. Any tenderness?
No.
And I don't feel any hernias. And I'm going to lightly palpate her abdomen, just checking for any guarding or tenderness. Any tenderness?
No.
Okay. So then you're going to palpate a little bit harder for rebound tenderness. And you should not be able to palpate the spleen. If you do, it is enlarged. And the patient's going to take a deep breath. And when she does, you should feel the liver just slip right under your fingers, right under the rib cage. And the liver should not extend below the rib cage or beyond the rib cage. And it does not, so there's no liver enlargement. Okay. So while she's lying down, I'm going to do some active range of motion, or passive range of motion, with just her hips and her knees. So just let me do the motions, and you just tell me if there's any tenderness, okay? Outward, and crossover. Good. Now the other side. Up to your belly. Good. And then out, and then crossover. Good. Any tenderness there?
No.
Okay, good. Next we're gonna do some deep tendon reflexes. So she's gonna sit back up, and I'm gonna use my reflex hammer. We're first gonna test the tricep, and you're gonna let your hand or your arm just relax into my hand. And you're gonna do this on both sides, comparing each side. Good. brachial. And relax just. And then radial over here. Brachial. And again, radial. Okay. If you can sit back, we'll do your patellar, which is the knee. Good. Okay. And Achilles is right behind the heel. Okay. All reflexes are symmetric, and they've got a good response of about 2+. The next thing we're gonna do is her rapid arm movements. So she's just gonna put her hands on her thighs and go back and forth like this. Good. Okay, you can stop. We're gonna do nose to my finger next, and we're gonna do both sides, okay? So you're gonna touch your nose, and then you're gonna touch my finger as it moves, okay? Good. Good. Now the other side. Okay. Good. Her movements were symmetric and smooth. There's no neuro defects that were noted there. She's just gonna squeeze my fingers next with both of her hands. We're gonna just test her grip strength. And it is about 5 out of 5, and it's equal on both sides. Good. Okay. So next thing you can do, we're gonna have you stand up. And we're just gonna inspect right now. Everything looks symmetrical. I don't see any signs of trauma or bruising. Do you have any tenderness at the moment?
No.
Okay. I'm just gonna palpate the larger muscle groups for any tenderness. And feel muscle tone, and everything feels symmetric. Again, no tenderness noted?
No.
Okay. Are you able to just squat down a little bit for me? Good. Okay. Next thing I'm gonna have you do is put your hands on your hips and lean side to side. Good. Bend forward and bend backwards. And this just assesses C-spine and lumbar spine. We're gonna have you do your arms now. So up above your head, come down, up this way, good, come down, and behind you, good. Okay, shoulders are normal. We're gonna do your elbows next, so go like this, okay, and then across, good, and one more, good. Any pain or tenderness?
No.
Okay. The next thing we're gonna do is just test her gait, and she's gonna walk to that side of the room just normally and come back. Good. And then I'm gonna have you do it one more time back. You're gonna go over there on your toes and come back on your heels. Good. Okay, that concludes our physical exam.